Preeti presenting Tackling COVID-19, a special show we get for you each day to apprise you with all the developments on the pandemic. It's 4th of May today and the third phase of the lockdown begins from today onwards, even as the infected cases continue to rise globally and in India too. Keeping this in view, the lockdown has been extended for another 2 weeks. The entire country has been divided in red, orange and green zones. Guidelines have been issued to allow easing of many restrictions in the green and orange zones in several states, but restrictions continue in the red zones. We get you the details of this. Added to it, we also get you global updates on the virus, and also we'll get you inputs from our reporters. Stay with us for the next half hour. We begin with the headlines. The new guidelines of the Union Home Ministry for the extended lockdown till May 17 to come into effect from today. Guidelines allow easing of many restrictions in the green and orange zones in several states, including opening of shops selling non-essential goods. Red zones continue to have restrictions. Centre writes to states saying movement of only stranded persons has been allowed and not of those residing normally at other places than the native places for purposes of work. Inter-district movement within the state continues to remain restricted. Union Health Minister Dr. Harshvardhan says India has achieved a major milestone by crossing 1 million COVID-19 tests while clocking over 74,000 tests per day. Says the government has distributed around 20 lakh PPE kits all over India and supplied medicines to more than 100 countries world over. Union Health Ministry deploys central public health teams to assist 10 state health departments in COVID-19 management. Teams to assist in implementation of containment measures in affected areas of 20 districts. Active COVID-19 cases across India rise to 29,453 with 11,706 patients cured and discharged. Death toll reaches 1,373. And coronavirus cases continue to spiral up across the world. Infections worldwide crossed 35 lakh with over 2.47 lakh deaths. The United States remains worst hit with over 67,000 fatalities. And first, we'll take stock of the developments in India in our segment Ground Zero. First, let's take a look at the latest COVID-19 updates from the country. As of today morning, the active COVID-19 cases across India stand at 29,453 with 11,706 patients cured and discharged, while the death toll has reached 1,373. The recovery rate is improving, which is now 26.59%. The doubling rate is also improving. In the last 3 days, the doubling rate is 12 days. In the last 7 days, the doubling rate stands at 11.37 days, while for past 14 days, it is 10.4 days. And up next, in detail, we'll get you the scenario in the whole country. We'll take a look at the map, which gives us the details of how the states are affected in the country. When we talk of it, the first state we see is Maharashtra. 12,974 are the total cases, out of which 10,311 are the active cases. 548 have been the deaths. 2,115 have been the recoveries. Maharashtra is the worst hit state in the country with 12,974 total cases. And yes, here we'll have the map wherein we just spelt out the details of Maharashtra. 12,974 are the confirmed cases. 10,311 are the active cases of the total confirmed cases. 2,115 have been the recoveries so far, and 548 have been the deaths. Remember, Maharashtra is the worst hit state in the country. With that, we go across to Gujarat. Gujarat, 5,428 confirmed cases, out of which 4,096 are active cases. 1,042 are the recoveries and 290 are the fatalities. 290 people have lost their lives owing to the pandemic. Now going across to national capital, confirmed cases 4,549 are the confirmed cases, and out of these 3,123 are the active cases, and recoveries are 1,362, and 64 people in the national capital have lost their lives because of the pandemic. When we talk of Tamil Nadu down south, 3,023 are the total cases which have been reported, out of which 1,614 are the confirmed active cases, and out of the confirmed cases, 1,379 are the recoveries and 30 are the fatalities. Remember, when we get you the details, the statistical details of the states, we are also specifically mentioning the recoveries, and recoveries in every state are more than the fatalities. And this is the gist of the crisis, that you have to take precautions yourself. Remember, these recoveries have been made owing to the guidelines, rigorous following of the guidelines which have been put forth by the centre when we talk of social distancing norms, self-isolation, keeping yourself healthy and maintaining personal hygiene. These are the three most important points which you have to take care in order to prevent yourself and your near and dear ones from the infection. We go across to Madhya Pradesh. In Madhya Pradesh, 2,846 are the confirmed cases. Out of these, 1,892 are the active cases. 798 have been the recoveries which have been made so far, and 156 people have lost their lives in Madhya Pradesh. The next state we see is Uttar Pradesh, the largest state in the country. Confirmed cases, 2,645 are the confirmed cases. 1,848 are the active cases. Out of the confirmed cases, 754 have been the recoveries which have been made, and deceased, that is the number of fatalities, are 43. And again, the next state we go across to is Andhra Pradesh. In Andhra Pradesh, confirmed cases are 1,583. There are 488 recoveries in the state. Also, the active cases are 1,062, and 33 people have lost their lives in the state of Andhra Pradesh. Going across to Punjab now, confirmed cases are 1,102, and active cases of these are 964. 117 are the recoveries which have been witnessed in the state, and 21 are the fatalities. And with this, we go across to the next state, that is Telangana. In Telangana, 1,082 cases have been reported. Out of these, 563 are active cases. 490 are the recoveries made, and 29 are the deceased people. 29 are the fatalities. In the state of West Bengal, 963 are the confirmed cases, out of which 777 are active cases. 35 people have lost their lives, while 151 people have completely recovered from the illness and they have been discharged from various hospitals. And when we talk of Jammu and Kashmir, in Jammu and Kashmir, 701 cases have been reported. Out of these, 406 are active cases. 287 people have made recovery so far, and 8 people have lost their lives in the state of Jammu and Kashmir. So more or less, these are the states and the statistical data when we talk of the current situation of COVID-19 in the state. Again, the crux of the situation is that we need to be careful and we have to follow the social distancing norms, and we have to keep ourselves isolated. Added to this, do not forget to keep washing your hands regularly with soap and water, regular intervals. And if a soap and water is not readily available, use a hand sanitizer. These are small ways by which you can ensure your safety and the safety of your family members, your near and dear ones. Taking precautions is the best way to keep COVID-19 at bay. Up next, the central government on Friday issued guidelines for extended lockdown restrictions after classification of districts into red, orange and green zones based on COVID-19 risk profiling. During the extended period of the lockdown, many activities have been allowed in orange and green zone, while red zone sees a limited opening for providing essential services. Up next, we'll take a close look at all the guidelines for the 3 zones. And here we have the visuals. Yes, the graphics on your screens, identification of the zones. As we told you, green zones are the districts with 0 confirmed cases. Red zones or the hotspot districts are defined by the Health Ministry, taking into account the total number of active cases, doubling rate of the cases, extent of testing. And also the next zone is the orange zone, that are neither defined as green zones or the red zones. Now, these are the guidelines for the government to see the containment zone most sensitive from COVID-19 viewpoint. And these are the measures which are being taken by the government. On your screens, we have from counseling to tracking people, tracing people, and up next we have on your screens are the activities which are prohibited throughout the country irrespective of the zone. Remember, the third phase of the lockdown begins today, and some activities are allowed in the green and orange zones, but restrictions, strict compliance of restrictions is to be there in the red zones. Now, these are the activities which are prohibited throughout the country in all the districts, be it red, yellow, be it red, orange or green zones, and these activities are prohibited irrespective of the zone. When we talk of these activities, more or less all these activities involve huge gathering of people, which is the main concern at this point in time, to avoid going into huge gatherings and to avoid large gatherings. And these are the measures for the well-being and safety of persons, and these are to be applied, these are to be held valid across the country. Movement of individuals for all non-essential activities has been prohibited between 7 p.m. and 7 a.m. And in the red zones, now we'll specifically talk of the zones. First, we pick up the red zones. These are the activities which are prohibited in the red zones. Up next, we have the activities which are allowed but with restrictions. Now, red zones are also the zones which are hotspot districts, and these activities are allowed with certain restrictions. In every zone, we also have containment zones, and these activities are allowed outside the hotspots or the containment zones. All shops selling essential goods will remain open in red zones, but not in malls. In rural areas also, all shops will remain open for essential and non-essential goods. These are the guidelines which have been issued by the Ministry of Home Affairs in view of the third phase of the lockdown, which begins from today, and the lockdown has been extended for another 2 weeks. The next zone is the orange zone. Now, the orange zone are the zones which neither fall in the green zone or in the red zone. Now, these are the activities which are allowed and prohibited in the orange zone. Up next on your screens, we have the green zone. These are the activities which are allowed in green zone. Green zones are the areas which have not reported any case of COVID-19. And here, the MHA has also issued national directives for public places. And as we just mentioned, the main focus of these directives is to prevent huge and large gatherings, and all the activities, all the functions, everything related to huge gatherings, that has been put under check. And these are the directives which have to be followed for workplaces. Just a while back, we told you how essential some activities will be allowed during this phase, and these are the directives which have to be followed for the workplaces. Again, the most important point here is to ensure that social distancing is maintained at the workplaces, and the people respectively, individually, have to take care that they follow the guidelines and they keep themselves safe. As the nation has entered into the third phase of the lockdown, in which several measures have been taken to ease the restrictions as per the zones allotted to various districts, people in Himachal Pradesh's Shimla came out to buy essential items. While in Siliguri, tea plantation labourers returned to work in farms and are complying with the social distancing norms. Markets in Kerala's Malappuram also reopened, while people here are also seen following the norms of social distancing. Union Health Minister Dr. Harshvardhan yesterday paid a visit to Lady Hardinge Medical Hospital, the Lady Hardinge Medical College in New Delhi to check the health facilities available at the hospital. The Union Health Minister visits hospitals every Sunday to have a check on the medical facilities. While addressing the media, the minister said that the capacity of fighting with coronavirus is improving with each day. India has achieved a major milestone by crossing 1 million COVID-19 tests while clocking over 74,000 tests per day. The government has distributed around 20 lakh PPE kits all over India and has supplied medicines to more than 100 countries world over.
आज सरकारी 310 लैब और 111 प्राइवेट लैब ये देश में हम विकसित कर चुके हैं। कल हमने 1 मिलियन टेस्ट यानी 10 लाख टेस्ट जो है इसके आंकड़े को पार करा देश में, और खाली एक अकेले दिन के अंदर लगभग 74,000 के करीब हमने टेस्ट किए। ये अपने आप में एक भारी सफलता है। जिस देश में पीपीई और N95 मास्क जो है बाहर से इंपोर्ट करना पड़ता था, आज एक दिन में हम 2 लाख से ज़्यादा पीपीईज़ जो है वो भारत में बना रहे हैं। कल हमने 2 लाख से ज़्यादा पीपीई जो है वो रिसीव किए मैन्युफैक्चर होने के बाद भारत में, और उनको सारे देश को डिस्ट्रीब्यूट किया। 50 लाख से ज़्यादा N95 मास्क हम देश को बांट चुके हैं। 20 लाख से ज़्यादा पीपीई किट्स हम देश को बांट चुके हैं। और जो हाइड्रोक्सी क्लोरोक्विन जैसी दवाई है, पैरासीटामोल जैसी दवाइयां हैं, ये दुनिया के 99 देशों को हमने सप्लाई की हैं।
As many as 20 central public health teams from Ministry of Health and Family Welfare have been formed and are being sent to 20 districts that are reporting the maximum number of COVID-19 cases in the country. The centre has deployed 20 public health teams to assist 10 states in the fight against COVID-19. Each team consists of 2 members and it will be assisting states in the COVID-19 management. 20 central public health teams have been deployed across 20 districts in 10 states. While 3 teams each will be sent to Andhra Pradesh, Maharashtra and Gujarat, 2 teams each have been earmarked for Delhi, Uttar Pradesh, Madhya Pradesh and Rajasthan. 1 team each will go to Telangana, Tamil Nadu and West Bengal. The teams shall report to senior state government officials and assist the state health departments in implementation of containment measures for COVID-19 in the affected areas within the designated areas. Now, these teams will be deployed till further orders and will submit reports to the senior officials of the respective states. Ministry of Home Affairs has allowed the movement of migrant workers, students, pilgrims who are stranded in different parts of the country. Home Secretary Ajay Bhalla yesterday wrote a letter to Chief Secretaries of the states clarifying that the order regarding movement of persons amid lockdown is not extended to those categories of persons who are otherwise residing normally at places other than the native places for purposes of work and those who wish to visit their native place in normal course. In order to ensure faster resolution of the complaints and issues of the drivers on passage of goods carriers for interstate movement, including empty trucks across the country during lockdown, spokesperson of the Ministry of Home Affairs tweeted, and I quote, MHA control room functioning round the clock to monitor pan-India efforts to fight COVID-19. Now 1930 and 1033. These are the helplines, and these are to be utilized for resolving issues of drivers and transporters regarding smooth movement of goods carriers, including empty trucks on the national highways. And let's now scan through the developments from across the globe in our segment World Wrap. In United States, New York Governor Andrew Cuomo has stated that the state would join a consortium of 7 Northeast states to purchase medical equipment required to treat coronavirus patients. Cuomo said that coming together as a team would allow them to be more competitive with suppliers who sell to the highest bidders, which typically tends to be the governments of the countries. New York is the hardest hit state by coronavirus. It will require hospitals to have a 90-day stockpile of personal protective equipment in case of another outbreak, as Governor Cuomo announced. The U.S. has reported more than 11,57,600 cases of the virus so far, and the death toll in the U.S. tops 67,000. Activities in California's Orange County came out carrying U.S. and Trump 2020 flags and also posters to register their protest, demanding Governor Gavin Newsom to reopen beaches days after he closed them because crowds defied public health guidelines to throng the popular shoreline last weekend. Orange County has confirmed more than 2,630 cases of the virus, with 52 deaths. U.S. President Donald Trump expressed confidence that coronavirus vaccine would be available by the end of 2020. Trump, in a television interview, said that the U.S. government is putting its full power and might behind remdesivir, a drug that has shown early promise as a treatment for the disease caused by new coronavirus. He also said that his administration was pushing hard for remdesivir to be available by the end of the year. Scientists around the world are currently racing to develop such a vaccine, but most experts expect that it will only be ready for mass distribution sometime in 2021.
We are very confident that we're going to have a vaccine at the end of the year, by the end of the year, have a vaccine. We're going to lose anywhere from 75, 80 to 100,000 people. That's a horrible thing. We shouldn't lose one person over this. This should have been stopped in China. It should have been stopped. But if we didn't do it, the minimum we would have lost is 1.2 million, 1.4 million, 1.5 million. That's the minimum. We would have lost probably higher than, it's possible, higher than 2.2.
Canadian Prime Minister Justin Trudeau has promised additional funding for mental health care services and coronavirus research. He said that he understands the stress caused by the shutdown of businesses across the country and orders to stay inside. He also announced that Ottawa would spend $240 million Canada dollars to help develop virtual mental health tools to deliver support digitally. And the death toll in Italy from novel coronavirus has crossed 28,880, while there are more than 210,710 cases of the infection in the country. From Monday, some restriction measures are being lifted in the country. People will be able to leave their homes more freely, and more workplaces and parks will be allowed to reopen, provided they meet social distancing rules. But most shops will stay shut until May 18th. Schools, cinemas, theatres, museums and hairdressers remain shut and will be reopened at staggered future dates. And each day we get you words of wisdom and advice from doctors who guide you with tips and pointers that help you keep safe. Today we get you a special capsule on how real-time polymerase chain reaction, that is RT-PCR testing, is conducted to detect COVID-19. Take a look.
How does COVID-19 testing work? There are different techniques to detect novel coronavirus in the body. But the one which is widely accepted is RT-PCR. RT-PCR, or reverse transcription polymerase chain reaction technique, is being used to detect SARS-CoV-2. The first step of the RT-PCR test is to collect samples. The sample is collected from the nose or throat of a suspected person. The second step involves extracting viral RNA from the sample. RNA and DNA are the genetic materials which are unique to an organism. The extracted RNA is now converted into DNA. The new formed DNA is known as complementary DNA or cDNA. The third step includes making multiple copies of a part of cDNA. These copies of cDNA are made using a technique called polymerase chain reaction. Now this part of cDNA is matched with the genetic material of SARS-CoV-2. If there is a match, then the person is confirmed positive. This is the best method to detect SARS-CoV-2 and it is recommended by WHO.
All right, so that was about testing of COVID-19. Time now to end this edition of Tracking COVID-19. But again, remember, social distancing, self-isolation and maintaining personal hygiene. These are the best precautions you need to follow to keep yourself safe. On that note, we'll end this edition here. Thanks for watching. Bye-bye.